Guys, we're continuing with the pulmonology. The lecture today is hemoglobin dissociation curve or hemoglobin association curve. Actually, it is association and dissociation curve. The topics that we'll cover today are, number one, the structure of the hemoglobin, because it is the structure of the hemoglobin that imparts the properties of the dissociation curve. Then we'll look at the dissociation curve itself and see what it means. Then we'll talk about various quantities of blood and what kind of oxygen that carries and what is the role of hemoglobin in that. Then various factors that would affect the dissociation curve, and finally role of the hemoglobin and this dissociation curve or this property of the hemoglobin to buffer oxygen tension in the peripheral tissues or to maintain the PO2 of 40 in the tissues. So let's start. The first thing, hemoglobin structure. Look, hemoglobin is formed by succinyl CoA. So succinyl CoA coming from metabolic processes and glycine. These two things combine and they form the basic structure, the pyrrole ring, which is, again, this is not the biochemistry lecture. I just want to make sure that we understand the things that are taking part in it. So this is a pyrrole ring. What we have here is we have nitrogen and then we've gotten a pyrrole ring with the propionic acid and acetate. So that is what we got. So basically CH2COO negative, that is the acetate, and CH2COO negative, that is the propionic acid. So CH2COO negative and CH2COO negative here. So that is the structure that is called a pyrrole ring. What happens is 4 of such rings, they come together and they combine by methine bond. So if I make this, so here is how to make it. I'm going to show you how to make this one. So make one ring. So I remember it this way, that a ring stands like this, the other ring stands like this. So let's see. So one ring stands like this, and one ring stands like this. So this is a ring. This ring is standing like this. So the bond is here. I'll explain why like this. Opposite to this, make another ring that stands like this. It has double bonds here. Of course, there is nitrogen here and nitrogen here. Then make 2 more rings. So here and here. These 2 rings have nitrogen as well, but their bonds are going to be shown like this. See this ring that is like this? These 2 rings are facing it. So their bonds are like this and this, which is same like this one, plus they are facing this guy, so they have double bond here as well. Then, so these are 4 pyrrole. Of course, there is acetate and propionate. So how is that? AP, acetate, propionate, then AP, acetate, propionate, AP, acetate, propionate, and the last one, instead of AP, it is PA. So that is the structure, and then combine them with methine bond. Now the question is, what are the double bonds here? So see this one that is standing like this. These bonds here, these bonds are double bonds. So they are all horizontal. And this one that is standing like this, it has these bonds here. How about that? So that is the structure of the 4 pyrrole rings that have come together. This has now become protoporphyrin 9. Now, in case of the human hemoglobin, the protoporphyrin 9 has methyl, vinyl and propionate as the A and P bonds. Okay, so we're not going in there. What we want to do next is, what happens is in the center of these nitrogen bonds comes ferrous, two positives. So ferrous has S in it. This S looks like a 2. So 2 positives are ferrous. Ferric is 3. Secondly, ferrous makes bonds with oxygen, ferric does not. So now what we will make here is, look, ferrous has already made 4 bonds with the 4 nitrogens. It is going to make 2 more coordination covalent bonds. These are the bonds called coordination covalent bonds. These are weak bonds, although they are called covalent bonds, and they are made with the molecule instead of the ions. So let me show you how these are made. So imagine this is the same structure as you see here. So this is one plane of the molecule. If you make this plane horizontal like this, now you have the 3-dimensional structure. Ferrous can make a bond upwards from this plane like this, and it combines with the oxygen molecule with a weak bond here, and it will make another bond downwards, and it would combine with a protein with a weak bond here. These bonds are called coordinate covalent bonds. So one above and one below. So let's make that as well. So if you take this structure, you make this structure a little planar. In the center of the structure is sitting ferrous disk, and these are the 4 pyrrole groups. Now above this one is oxygen O2, oxygen molecule, not oxygen atom or ion, and below this is some protein. Now this becomes hemoglobin. So see here, first of all we had a pyrrole ring, then we had protoporphyrin, then protoporphyrin combined with ferrous to make heme, then heme combined with a protein to make hemoglobin. This hemoglobin now can combine with oxygen to make oxyhemoglobin, or with carbon dioxide to make carboxyhemoglobin or carbamate hemoglobin, and it can combine with carbon monoxide as well. The only thing is that normally carbon dioxide does not occupy the same bond that is occupied by oxygen. However, carbon dioxide would occupy the same bond, and carbon dioxide has 200 to 250 times higher affinity to combine with the ferrous compared to oxygen. What does that mean? What that means is, if the carbon dioxide's pressure is like 1.1 millimeter of mercury pressure, even then it would combine and dissociate oxygen or compete with oxygen, compared to oxygen's 100 millimeter of mercury pressure. So if there is 100 millimeter of mercury pressure for oxygen and 0.1 of the, or 1 of the carbon monoxide is going to win. So that's really, really important. And also realize that carbon monoxide sits on the hemoglobin instead of dissolving in the blood. Because of that, blood still carries oxygen and hemoglobin carries carbon monoxide, and the blood oxygen carriage is just 3%. It's not sufficient to give us oxygen. However, it is sufficient to make the color of the blood red. So a person with the carbon monoxide poisoning, you cannot look at his mucous membranes and see he has hypoxia or hypoxemia, because his blood color is still red, because dissolved oxygen is present and that is not dissociated or removed by carbon monoxide. That is why carbon monoxide is really, really dangerous. Anyway, so this is the structure of the hemoglobin. One more thing that is really important to understand the dissociation curve is that this hemoglobin comes in 2 states. We call them, and now hopefully you will call them, tense and relaxed state. What that is, we call them T and R states. What that means is that this molecule, this hemoglobin molecule, can sit in a, I'm going to make an abstract structure here, or an example structure only. Let's say this is the structure. These are the 4 hemoglobin molecules attached with a protein. So what happens is that when oxygen attaches to one of the molecules, one of the heme chains, subchains, then, I have to tell you one more thing. There are 4 such chains. So this is one this is not a hemoglobin. This is a hemoglobin subunit or a chain. 4 such chains come together to make hemoglobin. And there are variations of the chain. There can be alpha chains or beta chains. For example, normal adult hemoglobin is 2 alpha and 2 beta units coming together to make a hemoglobin. So one hemoglobin molecule can actually carry 4 molecules of oxygen. So that means 8 oxygen atoms, because one heme subunit carries 2 oxygens. So please scratch if I had said that this is hemoglobin. This is the subunit of hemoglobin. So these are the 4 subunits of hemoglobin, each that can carry oxygen molecule with it. When the first one becomes connected to the heme subunit or the chain, that causes the other chains to become easier to connect. They have conformational change in them. Their units which combine with the oxygen, those combining sites open up a little bit. So it is easy for oxygen to come in. So the first one is really difficult to attach. Oh, fine, I'll get it. So once that is done, the second one, which was also difficult, opens up a little bit. So it is relatively more difficult but easier than the first one to attach. When that second one gets attached, the third one becomes more open, and it is easier to attach the third one. And when third one attaches, the fourth one becomes totally open, and it is easier to put the oxygen in it and even remove from it. This process, this flexibility of hemoglobin protein, is why hemoglobin protein is called the most flexible protein in our body. When it is in the lungs, it receives oxygen. When it is in the tissue, it gives oxygen. It changes its behavior so fast. And there are so many theories at why it does that, and I'm not doing the postgraduate lecture here. Just remember this, that hemoglobin changes its state, and we'll look at in the lecture today, we'll see why does it do that. So now, sometimes hemoglobin gets stuck in a state where it is really difficult for it to receive more oxygens. That is called the tense state. Tense state is a state where deoxyhemoglobin is preferred. Hemoglobin's mechanical structure, physical structure is such that putting oxygen is difficult. In a relaxed state, as I just showed you, it is easier to put oxygen on it. So relaxed state and tense state, and we'll talk more about it. But keep this in mind, first oxygen molecule difficult, and then the next become relatively easier. Once again, I want to make sure that you're aware, this is one heme unit, hemoglobin subchain. So such 4 chains will come together. So this is one chain that has ferrous in it, will allow oxygen to be carried. Then there will be one more, ferrous will allow oxygen to be carried. Then there will be one more and one more. So how many oxygen molecules it would pick up? One hemoglobin, it can pick up 4 molecules and 8 atoms. 2 plus 2 plus 2 plus 2. Normally, now remember this as well, normally one of the heme subunit always stays oxygenated. It never dissociates. It was really difficult to attach to it, but once you're attached, this oxygen never goes away. So 25%, remember these are 4. So 25%, 25%, 50, 75 and 50, 100. 25% of oxygen is always saturated on the hemoglobin. Saturation means oxygen loaded on the hemoglobin. However, it is one of these, just one of them, which normally is loaded, unloaded, loaded, unloaded. So we actually say that hemoglobin in normal states only works with the 25%. That is called the dissociation coefficient or utilization coefficient. So utilization coefficient is normally just 25%. This can go up to 75% in case of exercises. So instead of just one oxygen removing, there can be 3 oxygens that can be removed. But removing the 4th one is really difficult, but it can be seen in some situations as well. Now let's talk about the dissociation curve itself. These are the properties to keep in your mind. Look, here is the curve. On the x-axis, we have the partial pressure of oxygen present in the tissue or in the capillary or in the lung tissue, whatever, wherever we are, wherever the hemoglobin, this molecule, wherever it is present, the partial pressure in that place. And then the percentage of hemoglobin that becomes saturated or loaded onto that means loaded with oxygen. So percentage of this hemoglobin and how much oxygen is loaded on it, under what pressure. So please remember this, hemoglobin does not make a covalent bond, although it is called coordinate covalent bond, but it is not a covalent bond itself. It is a weak bond that can be easily dissociated. So look at it this way. What is the situation in the lungs? I'll make that over here. Lungs. Remember that in the lungs, and I always represent lung like this with one alveolus. So lungs have, we know, the partial pressure of oxygen, PaO2, alveolar O2 is 110 millimeter of mercury. We know that. So when the blood vessel is present here, so this is the blood vessel, capillary. And this capillary has hemoglobin sitting here. So let's say this is 1 unit chain, this is second chain, this is just one molecule of hemoglobin, and this is the fourth chain. So it has 4 subchains. This is one molecule of hemoglobin, right? What is the pressure here in this area? 110. When oxygen under 110, so somewhere over here, under this pressure, 110 millimeter of mercury, right, PO2 millimeter of mercury, under this pressure it is about 97% saturated. What does that mean? That means most of the hemoglobin molecules are fully loaded with the oxygens. And why are they loaded? Because of the partial pressure of oxygen being high. That means that the affinity of the hemoglobin to receive the oxygen is also contributed by the pressure of the oxygen there. So oxygen kind of increased oxygen molecules push the oxygen into the binding sites. However, imagine if you are here, this is in totally empty hemoglobin, this is the first time the person is breathing, the baby has never breathed before, there is no oxygen attached to the hemoglobin, which is never the case, but let's say theoretically that is the situation. First oxygen association will take a lots of energy, so we'll have to really increase the pressure. But as soon as the first is done, the second, third and fourth are really easy to attach. Once it is attached, once you have hemoglobin that is attached, you're adult, then when that hemoglobin reaches here, when it reaches, this hemoglobin usually only has one oxygen that is not attached and the rest has oxygen attached. So 70% saturation is already there. So it is easier to just saturate this 1% and be done. Voila. So why do we say 97%? Because there are impurities in the hemoglobin. Some of the hemoglobins are not going to become fully saturated and they are just going to go out without the saturation. So total, if you count it, it is about 97% saturation. Okay. So in the lungs, this is the area that as you increase the pressure, you load the hemoglobin. It is easier. That is why we say that the plateau is this sort of flat surface. Plateau of the dissociation curve represents the activity inside the lungs. It is easier to load as the pressure varies. And can you imagine this? Imagine if you go to a mountain, you go to a higher pressure, where the higher altitude, where the pressure of oxygen is low. Let's say it is, instead of 110, it is 60. It is so low, almost half the pressure. Even then you can see that about 86-88% saturation is still there. That is the magic of the hemoglobin, that even when the pressures of oxygens are changing outside in the atmosphere. And how about this? If we take the pressure from 110 to, let's say, 300 millimeter of mercury, really high. How much was already loaded at 110? 97%? See? 97%. So how much more can be loaded? Only 3% if the hemoglobin allows, if the impurities are not there. So even if you really increase the pressure of the oxygen, you are only going to give another 3% to it, which will not make a lot of difference. This is the buffering effect of hemoglobin to keep the partial pressures of oxygen same and maintain them at P40 in the tissue. So please remember that. So the plateau area is representing the activity that happens inside the lungs. How about now the sloping area, this sloping area? This is the activity that happens, this represents the activity that happens in the tissue. So let's look at the tissues, what happens there. So let's say this is a tissue cell, and we know that the tissue cell, we did that in our last lecture, is generating carbon dioxide and pulling oxygen. So here the oxygen tension is really low. How much low? PO2 is 40 millimeter of mercury. So now hemoglobin came in here. This hemoglobin was all happy and saturated with, let's say, 100% oxygen. O2, 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 O2. If you can't see it, just 4 O's, fully loaded hemoglobin molecule. The pressure became 40. So how much is the pressure difference? Here the pressure was 110. Here the pressure dropped to 40. So about 70 millimeter of mercury pressure of oxygen dropped. Come back here and see what happens at 40. Let's connect it. So my graph, because I drew it with the hand, about 86%, somewhere over here. It should be like little like this. So about 86%. So how much is dissociated? From 100%, 97%, 86, we came down to 86%. So 13-14%. Normally we say that about 25%, one oxygen gets dissociated and goes. So can you imagine that from here to 40 till here, this is the oxygen that got removed. So this curve, as you move towards the left on this curve, this is the dissociation of oxygen, and this is what is happening in the tissue. Now imagine this. Now this is an important point. Imagine you started doing exercises. What happens with the exercises? The utilization of oxygen increases, utilization coefficient would increase. Now when the oxygen utilization increases, what happens to the pressure? It drops. You know that the pressure can drop, we did that in the last lecture, up to 15 millimeter of mercury, PO2. So check here what happens at 15. Here is about 15. And look at this. How much percentage has become unloaded? As you come down, that means you're removing oxygen. How much oxygen you have unloaded? Almost 75% is gone. What that means is that out of this one molecule, which had 4 molecules on it, 3 are removed. And just 1, remember I said 1 usually stays on. Just 1 is left. So guys, as soon as you do exercise, hemoglobin gives 3 times more oxygen. Same hemoglobin, same molecule, same loading, same saturation percentage, gives you more. But one more thing to keep in mind now, plateau is horizontal and this slope is vertical, very sharp vertical slope. What does that mean? For a very small pressure change from 40 to 20, a lot of oxygen will be dissociated. How much oxygen? So let's say at 40 we had 75% saturated, 85% saturated. At 20, how much difference between the two pressures? Only 20 millimeter mercury drop, but with that drop, look at how much oxygen dissociation is done. Almost 50% oxygen from here to here has been given off. So 25% already given off, 50 more. So total 75% oxygen is given off. That is the power of this property of hemoglobin. Why is this way? Well, hemoglobin doesn't want the tissue to become hypoxic. So it is structured in a way to carry oxygen all the time and keep a buffer of oxygen on it. And as soon as it sees a tissue that is in demand, it immediately gives it oxygen without letting it go into hypoxia. However, if the tissue goes further down, then the last one is really difficult to dissociate. So what you say is this: the the slope part represents the activity in the tissue, the plateau part represents the activity in the lungs, or the plateau represents the loading of oxygen, and the slope part, the steep part of the curve represents the unloading of the oxygen. Make sense? Okay. So now also let's see quantities of hemoglobin. What happens is that imagine 100 milliliter of blood as a bus. This is a 100 milliliter of blood. Here is a tiny bus driver sitting and driving it. This is 100 milliliter of blood passing through our body. 100 ml of blood contains 15 gram of hemoglobin. This 15 gram of hemoglobin has about 20 milliliter of oxygen attached with it. This is oxygen attached with it. Now this bus moves through the body, right? It comes out of the heart and goes through the systemic tissue. So when it moves through the body, what happens is, when it reaches the tissue here, so let's say it just goes to this tissue. When it passes through the tissue, do you know how much it unloads? We said utilization coefficient is 25%, so it downloads 25%. How much would that mean? Out of 20 ml, 5 ml will be given. That is 25%, right? If you take 20 ml and make 4 parts of it, then 1/4 will be given off to the tissue. So when the bus comes out of this was the arterial end, so it came in here, and when it comes out of here, the bus now has the venous blood. Check this out. Now this is the bus coming back. The venous blood has how much hemoglobin still present? About 50 ml still present. God, 20 ml came to the tissue, 15 ml went back. Only 5 ml was dissociated for the whole body tissues per 100 ml of the blood. That is the utilization coefficient. This 5 ml can reach up to 75 ml. What does that mean? That means at this area, instead of the bus taking 15 ml back, it would take only 5 ml back, and it would have given 15 ml to the tissues. So 75% to the tissues, 5%, 25% back. Normally 75% back and 5% to the tissues. That is really important, because how do you do the math? You take 100 ml, you calculate the saturation. Normally we say it is 20 volume percent saturation delivery. 20 volume percent saturation means that hemoglobin, or 100 volume percent, 100 volumes of blood has 20 volumes of oxygen on it, and that is carried by 15 gram of hemoglobin. Of course, if hemoglobin increases, then this would increase, and if hemoglobin decreases, then this would decrease. But here is an important clinical point. Do you think that with this hemoglobin, if you wanted to increase the volume percent of oxygen, if you wanted to increase the volume of oxygen going to the tissues, for example, it's a patient, can you with the same amount of hemoglobin increase that? Not really. Why? Because you're already 97% saturating. 3% is not going to make a difference. So in such case, you have to give transfusions. You have to give more blood with the hemoglobin content so that it can carry more oxygen. Now we talk about the factors affecting this curve. So in clinical terms, we use the expression that the curve is shifted to the right or curve is shifted to the left, like this. What does that mean? And then we'll talk about the cadet face right. So we'll talk about that mnemonic in a second. But let's see what does the curve moving towards the right means. At 100 millimeter of mercury, the curve that has moved to the right still has the same loading of oxygen percentage. So no problems there. So that means inside the lung, the loading of oxygen is still the same, saturation is 97%. Okay, but unloading has increased. So now how much unloading is happening, that if you come down, so let's say this one, this much was unloading before when we were at 40. Now the same amount is unloading at 55 millimeter of mercury. So tissue doesn't have to use a lot of oxygen, but it will get more oxygen. That is the effect of shifting to the right. Effect of shifting to the left means what? So now if the tissue wants the same amount of oxygen, it has to really use a lots of oxygen and bring the pressure down to 20. That sucks. Tissue is going to suck. It's going to really ask for oxygen and beg for oxygen, and it is getting really tiny amount. So the question is, why does this happen? First, what does right shift do to hemoglobin? Remember we talked about it, relaxed and tense state. Right shift means loading is okay, unloading is easier. So that means hemoglobin has gone in a relaxed state. So any factor that will favor the right shift will mean it would favor this protein to become relaxed and associate and dissociate oxygen easily. Any factor that shifts to the left means that hemoglobin has become more tense and it is not going to work, it's not going to leave oxygen easily. Actually, the other way around, sorry. Tense means it doesn't want to associate properly and it wants to dissociate fast. Relaxed mean it is associated and it doesn't want to give it off, it's just happy with that. So right shift tense, I'll write T here, and left shift R, or relaxed. So sorry for the other way around. Now here is a mnemonic. The mnemonic is cadet, so we are doing factors. Cadet face right. What does that mean? So C for carbon dioxide, A for acidity or pH changes, D for 2,3-diphosphoglycerate or bisphosphoglycerate, E for exercise, and T for temperature. So let's see what do they do. First of all, carbon dioxide. Look guys, carbon dioxide causes its effect in two ways. So if this is a hemoglobin molecule, on this hemoglobin molecule, carbon dioxide like to attach with the hemoglobin and make carbamate compounds. Those compounds would reduce the availability of hemoglobin for associating with oxygen. So in the peripheral tissue, carbon dioxide is more, so it favors the attachment to the hemoglobin, and that means it favors the dissociation of oxygen. In the lungs it is the other way around, carbon dioxide is less, so carbamate compounds are less, and that makes more hemoglobin available to attach with oxygen. Second effect that carbon dioxide does, plus metabolic rate does, is produce hydrogen ions, protons. Increase proton. How does carbon dioxide make that? Remember, carbon dioxide works with carbon dioxide plus water, gives off HCO3 plus proton. This is the proton we're talking about. This is carbonic anhydrase. We'll talk about it. So whenever there is more carbon dioxide, there is an additional factor, and that is there is more hydrogen ion. When there is more hydrogen ion, that means pH has reduced. pH reduced or acidity increases the oxygen dissociation, which is natural, right? If a tissue is using more carbon dioxide, more oxygen, doing more metabolism, producing more carbon dioxide, there will be more acidity here for two reasons. One, tissue produces acid when it works. Second, carbon dioxide would work with, combine with water and produces hydrogen as well. That acidity causes something to the hemoglobin. What does that do? Really, really interesting. So let's see that. Let's say for acidity, this is the hemoglobin, right? So I'm going to make globin proteins here. So these are the proteins. Remember, there are going to be proteins attached to every heme subunit. When there is hydrogen ion present, that hydrogen ion or the protons go and get attached with the proteins. Remember, proteins are normally more negative. So for example, they get attached to the histidine 164s. And the result of that is that the protein has a conformational change in them, and they start helping the hemoglobin to go into a tense state because of this protonation. Secondly, the nitrogen bond area also get affected with the protons. The end result is that hemoglobin shifts from a more, I want to keep oxygen with me, relaxed state, to a tense state where it says I want to dissociate oxygen. That allows the hemoglobin to release oxygen easily. So acidity causes, or reduced pH causes, oxygen release favoring, or the tense state favor. How about 2,3-BPG or 2,3-DPG? 2,3-DPG is a byproduct of the, or is a product of the glycolysis happening in the RBCs. So when the 2,3-BPG levels increase, we have developed this mechanism in us that increased level means that somehow there is hypoxemia, oxygen is not available. So what 2,3-BPG does is, it is an allosteric controller of hemoglobin. So if I make that over here, so again this is the hemoglobin, 2,3-BPG attaches with the DPG or BPG, diphosphoglycerate or bisphosphoglycerate. When it attaches to the hemoglobin protein, it favors it to go in the tense state again. Tense state mean that this was the hemoglobin, it had the proteins, it had the oxygens in it, you made it tense and it dropped the oxygens, it removed them. So that is how 2,3-DPG shifts the curve towards the right. Then is the temperature. We'll exercise and temperature. We'll talk exercise in a second. Temperature. How does temperature cause the hemoglobin to dissociate oxygen easily? Simple. Number one, it's not a very dramatic effect. It's not a very big effect. So you don't boil a person to say, oh man, release more oxygen, or the patient needs oxygen and start increasing the temperature for him. No, don't do that. Oxygen, hemoglobin will become slightly denatured. We know that proteins become denatured with the heat. So when the temperature is increased, the hemoglobin's protein changes its shape because of extra energy present, and that causes it to go in a tense state and allow the oxygen to dissociate. And finally, exercise. Look, exercise has many factors. One, it causes increased acidity. So exercise itself has no effect on hemoglobin. There is no messaging to say, okay, Mobeen is doing exercises, all hemoglobins, listen up, dissociate oxygen. That doesn't happen. Instead, exercise does things. For example, it increases temperature. For example, it reduces the pressure of oxygen in the tissue, which means that dissociation becomes improved. Then exercise increases 2,3-DPG production. It increases lactic acid production. So as the other factors, it increases carbon dioxide production. So exercise itself is not a factor, but it changes other factors. It actually makes all other factors increased, which will mean that the curve would shift towards the right. So that is how the right shift of the dissociation curve will cause easy unloading of the oxygen while loading stays the same. Now let's look at the left shift. Left shift is mostly the reverse of these things: low temperature, less carbon dioxide, and so on. Left shift mean, and then some chemical compounds and poisons. Left shift simply means that it is difficult for oxygen to dissociate. So got it. So that is the factors that are affecting the curve. Finally, the last topic, buffering effect. Buffering, the role of hemoglobin to create a tissue buffer of partial pressure of oxygen. So look guys, it's very simple. In the interstitium, the pressure of oxygen is 40 millimeter of mercury. That is the same pressure that is inside the cells. We say that inside the cell is 23 millimeter average, but normally 40 millimeter near the blood vessels and 15 millimeter away from the blood vessels, capillaries. So now what happens is, imagine if the pressure reduces from 40 to 15, and come here and see, from 40 to 15 if you go, all of a sudden hemoglobin dissociated lots of oxygen. Hemoglobin would come here and dissociate a lot of oxygen. What would that do to the pressure here? It would maintain the pressure back from 15 towards 40. How about if we increase the pressure? Okay, so if we go from 40 to 60, all of a sudden the dissociation reduces and the pressure goes back towards 60. Towards 40. So that is a way you can read that from the dissociation curve as well, that as the change happens to the tissue pressure, the hemoglobin helps maintain that change at 40, helps maintain the pressure at 40. That's about it. Thank you.